Welcome to Storytelling. This week's guest is a medical doctor in integrative medicine focused on obesity, medical aesthetics, menopause and fertility. Previously the medical compliance and regulatory director at Besins Healthcare, she has been a principal investigator in more than 20 clinical trials. She has authored various publications and posters and presented at medical conferences and health technology assessments. In the pharmaceutical industry, she has helped lobby topics at Parliament and contributed to national guidelines. She delivers medical training, mentors doctors and Pranic Healers, and she is passionate about integrating spirituality in school and family life. She is a director of the British Pranic Healing Council and is a Basic Pranic Healing Instructor in the UK. Please welcome Dr. Gowri Subramanian. Hello, Dr. Gowri, and welcome to the podcast.
Good morning, and thank you for having me, Debbie.
Dr. Gowri, what is functional or integrative medicine?
So functional and integrative medicine is a combination of traditional allopathic medicine as well as mind, body, and spirit. So we diagnose as well as treat the physical and beyond the physical, including the psychological aspect and the spirit aspect.
So how does this differ from traditional Western medicine?
Traditional Western medicine is where we look and diagnose and treat the physical body. So we look at things like blood tests. We take the history from the patient and we then treat using medicines that could be tablets or injections or surgery, or using certain physical manipulation to perhaps reduce a broken bone or return it into place. We don't necessarily look at deeper issues, the origin of the problem, which is beyond the physical.
And can you share an example how addressing the root causes rather than the symptom changed a patient's outcome?
Yes. So, for example, heart attack. When someone comes in through the door, in the UK, we have a door to needle within 60 minutes. So we want to be able to get the best outcome for the patient to minimize the damage and the loss. So we're very, very good, and even we're excellent at the physical aspect of the management of the condition and treating it with oxygen, with medicines, and then we advise lifestyle changes. So we're good at addressing the now and the changes going forward. However, when you actually look at the origin of the problem, that bit is not necessarily being addressed or being addressed early enough. So we recognize in medical school that 80 to 90% of diseases start in the psyche, or there's a psychological component to it. So, for example, heart attack that I just shared, we say that they've been living a very stressful life, not had enough sleep, not enough diet, and it's been working a lot. So this is probably the primary origin of the problem. But we haven't had the preventative measures to address this. So this is where integrative medicine comes in, not just the treatment, but also the preventative, which is the larger part of healing and wellness. So, for example, here in functional medicine, in the case of myocardial infarction or a heart attack, if you say that the origin is predominantly stress or anger, and we then go back to the origin before a heart attack would have happened, that's where we do the preventative, or preventing another heart attack. Then we look at why the person is living in this manner. What are the tools, techniques that we can give or help the person to manage the stress so it does not then end up being a physicalized disease, such as a heart attack or a stroke. So when it's managed in the subtler, when it's an emotion such as stress or anger, then we can prescribe exercise, meditations, breath work, and working on the ability, certain softer skills. Perhaps some people are not able to stand up for themselves, to say, this is too much work on my plate, or I want a balanced family life. I'm going to draw a line when it comes to 5 or 6 o'clock at the end of a workday. So bringing out the entire wellness and fullness of being able to stand up for themselves and make sure they prioritize their mind, their body, their spirit, and a balanced life.
So you've talked about mind, body, and spirit, and that is the title of the episode, and how to have a balanced life. How easy is it to identify someone, or maybe help people to identify for themselves that they may need that mind, body, spirit prevention?
So I'd say this is the way it should have been. This is the norm, as opposed to, yes, we call it preventative medicine in terms of the language of health, but this should be the norm, as is in the schools. We're bringing in PHSE now. So this is the rhythm and how we should be. Workplaces introducing it still more as a reactive as opposed to a preventative. So it's always part of the rhythm to be able to be in control of our emotions as opposed to letting the emotions control us. So having mindfulness, breath work, and stillness is our regular part of our lifestyle. So we don't have to react or succumb when these energies become so heavy and physicalized as an illness. So everything starts in the subtler. So for example, if you wanted a cup of coffee, you first had a thought, yes, I'd like a cup of coffee. Then you actually physically get up, put the kettle on, and fix yourself a cup of coffee. But everything starts in a thought. So same thing I can say about perhaps, let's say, an energetic component and how that works on a sore throat. Everyone's probably has had a sore throat. So you roughly know about a day or two before that it's something is coming on. There's that scratchy throat feeling, there's the discomfort, and you overall have this knowing or instinct that this is coming on. So why that is the case is we have these energy centers. So in this modality of pranic healing, it's very scientific and structured. So that's where I expanded my knowledge as a doctor. Before that, it was a bit out there for me. And so when we know that it's starting, we start to tackle it in the energetic component. It either doesn't manifest as a sore throat, or if we catch it a little bit later, it is milder. And I can tell you, as a single parent, I definitely do this very often because I can't afford to go down.
So how does energy healing, which you've just mentioned, fit into the framework of functional or integrative medicine?
So functional medicine, as I said, we have many different components. So in the modality of pranic healing, we teach the energy healing and how we apply it. And we also teach patients how to apply it onto themselves for maintenance of their own treatment, where it's basically a wave of a hand. And how to, first of all, detect the energy imbalances in these energy centers, and then how to use hand movements to remove the energy blocks, and then bring in fresh positive energies from the universe to allow the body then to do its own thing. So a little bit like putting a body in a cast. So now the cast doesn't actually do the healing, but it helps to stabilize and still the body so that it can then take over and do its own recovery. So here in energy healing, we allow the body to help it accelerate the healing by removing these energy blocks. So the body can then take over and do what it needs to do. Then we also have in the same school things of breath work. So that helps. The power of breath draws in a lot of energy from the universe, which automatically helps these energy centers decongest and bring in the fresh energy. Because when we think we're breathing, that we're breathing oxygen, and of course we are doing that, but that's actually the smaller portion. The larger portion of the breath is actually what's called prana, or life force. And this is what keeps the body alive, keeps all the organs, the nutrients, and the sustenance from the energetic perspective, which is interwoven with the physical aspect.
Some people are skeptical about energy medicine, mainly because they don't understand what it is. So, how do you bridge that gap between science and spirituality and energy?
Oh, absolutely. We have many patients in the same boat. What I like about this modality in pranic healing, the founder, Master Chow Sui, the one thing he says is you're not obliged to believe anything you're told. So you try it, but you have an open mind as opposed to being completely closed. And that's what I say to my patient. Would you like to at least try it? So when you're neutral and being open, then there is an opportunity for you to then experience it and then see for yourself whether it actually works or not, as opposed to you have to believe it. You have to have faith for this to work. Because in the pranic healing modality, which is why many doctors are using it, because it's actually a science. So you see the results when you apply the stepwise process. It's not that you have to believe in it or you need to channel something in order for it to work. So the examples that we usually give is the likes of electricity or gravity. Whether one believes in it or not, it doesn't make a difference because the gravity still exists and electricity still exists. We don't see either of it. We see its effects, but we cannot actually see it directly. So it's the same thing as the law of life force or the law of prana. We don't actually see it, but we feel its effects.
What are some of the daily practices that help maintain alignment between mind, body, and spirit?
So the daily practices that we recommend is meditation on twin hearts. It's a 21-minute meditation, which is very loving. So it gives a lot of peace, stillness, and calmness. So we have this energy, the vibration that comes in. It's a great way to start the day. In the meditation, there are gaps between the chants of this universal sound of Om. Now, one of the powers of this gap is it allows us to extrapolate that to our life, meaning we don't have to react. We have the opportunity to utilize this gap to decide what we want to do and how we want to respond, including silence, which is a form of response. So it's starting this cellular level of programming. So this brings us into a more steady emotional state. So we go about still doing everything that we do, being an employer, employee, supermom, etc., but this time with the control of our state of being. Then we also have the breath work. That only takes a few minutes. And I teach my patients and clients in the middle of the day when you're being stressed, you just take 3 minutes. That's all it takes. And do these powerful breath techniques that we have. And we also have something called inner reflection and firm resolution. So this again helps with character building, drawing out some of the strengths that we have. So building a good self-esteem of what went well during the day or the previous day. And then what didn't go as well or as we had liked it to, and what would we have done differently. So making these three things a part of our routine only takes seconds to minutes, and it makes a world of a difference in our daily life.
So, for someone new to this approach, where should they start?
So I'd recommend starting with the meditation on twin hearts. So we have many of them around the country and even offered online as well. Or you can buy the app and start that way. Or look up a pranic healing course in your center, in your country. So there are many. It's present in over 130 different countries. So prana means energy. So energy healing or pranic healing. So we have a few around the country, and it's present in many different countries. It's a 2-day course which provides all these techniques for maintenance, not just of the physical body, as we said, also the psychological challenges that we have. Then it includes breath work, character building, as well as meditation. In 2 days is all we need to start to have a great life.
And how do you see the future of healthcare evolving with these holistic practices?
So medicine has evolved, and we work with allied professionals. They typically tend to be physiotherapists, occupational therapists, speech and language therapists, for example. Now it's expanding. So even if you look at the National Health Service in the UK, we're starting to have a bit more homeopathy and meditations and referrals for counseling and coaching. So it is starting to come about. So there is a recognition and therefore a budget within the public purse to address some of these issues, we are catching on. It will take time. NHS is a big beast, so it takes some time, but it's good to know that we are starting. We have a few hundred functional medicine practitioners in the UK, and it is growing, especially amongst the doctors.
And can I just ask you a personal question? What inspired you to pursue functional or integrative medicine?
So it was my own declining health, unfortunately. I was in a high-flying job. I was the head of medical, regulatory, and compliance in a pharmaceutical company in central London. It sounded glamorous with the being in one country one day in a conference and the flashy cars and titles and, rubbing shoulders with the big names, working on guidelines, parliamentary level. But it was extremely stressful, and I was also bullied at work, unfortunately. And I didn't know the tools and how to cope. We just suck it up as you do. You keep your mouth zipped and you carry on because that's what we know to do. And I was on vacation halfway around the world. And that's when I stumbled upon this course. It was serendipitous, and I never looked back. It was my last 4 days on the vacation. And I said, oh, what am I going to do? I'm going back to England. I need this in my life. It completely changed my life after the first day of this pranic healing course. And thankfully, like we said earlier, it's present in over 100 countries. So I came back to England and I did the next level. So you can advance if you want to grow your skills to become a more powerful and proficient healer. And they have the certification program, which I have done as well. And you can integrate. That's what I love as well. It's not alternative medicine. You complement it with what we do in allopathic clinical medicine.
So, when you personally feel out of alignment mentally, physically, or spiritually, what's your go to way to restore balance?
So I, first of all, step back. One of my favorite things is minding that gap that we have very famously in the UK. And this is built in many of the meditations, both in pranic healing, which is one arm of the school, and then the more spiritual arm or the signature arm, which is Arhatic yoga. So every meditation there builds in this concept of a gap, because actually it's there everywhere. Even when we're driving, if you're driving forward, if you then want to reverse, you're going to have to pause, you're going to have to brake before you change direction again. So it's built in everywhere in life. Breath in, breath out. Before you do that, there is a gap. Before the next breath, there's a gap. So if we actually pay attention to more of this gap, we can be far more efficient. So taking the breath, for example, and when we slow down and pause longer, there's a much greater chance of energy exchange, nutrient exchange, and gaseous exchange. So we become far more proficient when we utilize this gap. So we don't react like these knee-jerk reactions. We have an opportunity to then respond. And that would be my primary go-to. I have this gap. I have the opportunity to decide how I'm going to respond to the situation. As the famous saying goes, 10% is the event, 90% is how we react or how we respond to the situation.
What's the biggest lesson your work has taught you about being human?
Oh, wow. That's a big question. The biggest lesson that work has taught me is that to see someone as a soul with a body, wearing this costume, if we like. So irrespective of how they show up, because today we may wear a red dress and tomorrow a black suit. So the person or the soul is still the same, but they come up with a different appearance. And let us not judge a book by its cover. Let's look deeper within. So if someone is having a good day, or if they're a bit irritable, who is that person actually behind? Let's just seek to understand before we're understood. Are they going through something? Is there something that I can do to help their situation? So stepping back, looking at life through a larger lens, that we're all souls on a journey, trying to become better versions of ourselves.
And with that in mind, what does true wellness mean to you?
True wellness is the wellness of the mind, the body, as well as the spirit. So we constantly feed our physical body. So much in the media, in the school is focused on the physical. So absolutely, we need to do that between exercise and healthy foods, and also then feeding the mind with healthy emotions. So not constantly mentally criticizing someone, or being positive in our actions, in our words, and only saying what's kind and true and absolutely necessary. And then feeding our spirit or our soul. So doing meditation, world service, and making this world a better place. So this is the well-being on all three levels.
When you talk about world service, what do you mean by that?
So it could be something like a food bank, going around and helping people who are less fortunate, or donating money to different charities, or even picking up litter, tidying up, being a friend, helping colleagues when they're in difficult situations, or like we said, the meditation on Twin Hearts. That includes world service, because we're constantly blessing Mother Earth and using the power of alchemy to transmute, using energy to transmute any negative in the world to positive energies.
So we all have a responsibility to, as you say, make our world a better place, and we do that by giving, and then everyone receives abundantly in return.
Absolutely. The universe is abundant, and we start with ourselves, becoming better version of ourselves. And if everyone did that, the world will definitely be a better place.
So with energy healing, what you're referring to is that people can start to heal themselves.
Absolutely. So why this modality is different is there's a less chance of the patient returning to the clinic, because that's why I empower them to come and learn these techniques for themselves in just 2 days, or if they went up to the third level, which is including the psychotherapy. So in about 5 or 6 days, they're able to take on and their own healing, which is very different to having to come and see the practitioner regularly. And there's a full recipe book or a cookbook where they follow the steps listed in there, and they don't need any fancy tools. All they need is their hand to be able to use these techniques. Look at the protocol. If it says chronic sinusitis or diabetes, they look at the protocol, follow all the steps in there. Step 1, do this many times, do it this often, and this many waves of the hand, and or for energized with this many breath cycles. They have those tools to apply it for themselves, not just reactive manner when a disease or an illness or a pain appears, but also the ability to prevent something from happening, or being able to respond when there's an emergency, because an emergency is that exactly. It doesn't announce when it's coming. We don't know. Nobody knows when a stroke's going to happen. But having these tools helps to remove those energy blocks rapidly, well before even the ambulance arrives. So really saving a lot of the organs or the blood flow and blood supply. So it's extremely powerful. It's there for life. And in a few days, you can learn this, patients can learn these techniques for themselves.
And as we've mentioned previously, this isn't to take away from traditional medicine, but it's to work with and to supplement traditional medicine so that it's more preventative than it is to take away from a cure.
Or to accelerate the healing, yeah. So when someone, let's say, has to have a cholecystectomy, which is a gallbladder removal surgery, so you can apply pranic healing, and this is where the benefits of the patient being able to do it themselves, or they can come and find a practitioner and apply this pre-surgical treatment, so removing any of the negative energies within the system, including things like fear. You're going for a surgery. So when these energy blocks are removed, it's much easier, quicker, and less complications. You can apply the treatment also during the surgery and after, and it really hastens the recovery. We've had patients who have been able to walk after being paralyzed and told by doctors after 10 years they weren't able to walk. Or a typical hip fracture, which takes you anywhere between 4 to 6 months before you're really able to fully walk again. Within 2 weeks, people are walking by using pranic healing.
If you could leave our listeners with one message about healing the mind, body, and spirit, what would it be?
We are the ones in control of our emotional state. So whenever we put our happiness or our state of being in the hands of others, they're sure to drop it. This gives us the tools to take back the driving seat and be in charge of our life.
Dr. Gowri, you've given us so much food for thought. Thank you so much for being a guest on this podcast.
Thank you.
If you would like further details about Dr. Gowri Subramanian, then please follow links in the show notes.